Now we're recording. So welcome to the webinar. Thank you all for joining us this afternoon. We're really excited to have Dr. Ramos with us here today. I'm really excited for this talk. I think that it'll be super informative into what's going on right now with the coronavirus and how specifically in agriculture this is looking like. As usual, if you have questions for Athena, go ahead and send them in the chat box directly to me throughout the presentation. My name's Holly. And at the end, if there's not a bigger group than this, we will have questions fielded directly to her and allow you to unmute yourself and talk with her that way. Also, if you like something that she says, agree with something that she says, think something's really awesome, you can use the reactions at the bottom right of your screen. There's the clapping one and the thumbs up. Lindsay just demonstrated one of those for us, and I did a different one. Do that so we can see that you're all here and doing well and really are learning a lot from this presentation. Otherwise, Dr. Ramos, I'll turn it over to you.
Great. Well, thank you so much for the opportunity to join the group today. I'm excited to share with you some of our latest research about COVID and meat packing. But the talk today, the title is From the Farm to the Packing Plant, Essential Workers and COVID-19. So it's not going to just focus on meat packing, but also on farm workers. A little bit of background about me. I'm Dr. Athena Ramos. I'm with the University of Nebraska Medical Center. I work in the College of Public Health in the Center for Reducing Health Disparities, and I'm also associated with the Central State Center for Agricultural Safety and Health. And that's how I come to you today with this work and thinking about farm workers all the way to the processing plant. So I wanted to give you a little bit of background first before we get into the study. Farm workers there's about 1 million farm workers in the country, or people who are employed in agricultural, forestry, and fishing in the US. And there's about 500,000 people who are employed in meat packing and processing. And over half of the meat packing plants are located right here in our region in the Midwest. There's nearly 100,000 people who work in meat processing facilities in Nebraska, which is where I'm at, in Iowa, Kansas, and Missouri. So we know that the Department of Homeland Security noted that workers on farms and ranches and feedlots and other types of production agricultural sites and meat processing and poultry processing facilities have been deemed critical infrastructure workers or essential workers. We also know that the employers, the farms, the plants, the processors, the workers, everybody is worried about the spread of COVID-19 throughout the agri-food industry. And I think over the last couple of months, we've had a number of instances where there have been almost shortages of meat and things that were happening that have never happened I know in my lifetime and in probably at all in the US regarding the food supply. And so it demonstrates that we have a very sensitive industry, and it's very consolidated, which makes it even more sensitive to these what we call black swan events, these things that happen like once in a lifetime events that nobody could have ever planned for or predicted that they were going to happen. There's been a number of large COVID-19 outbreaks in the agri-food system. So if you've been paying attention to the news lately, you've heard about lots of different meatpacking facilities that have experienced large outbreaks. Some of them have had 900 cases that have showed up in one single plant. Some examples, if you look at Dakota City, Nebraska, they had 669 cases when this article had come out at the beginning of May, but now that's up to 900 cases. So among their workforce at that particular facility, they had a 15% positive rate. In looking at farm workers, we can look at Immokalee in Florida. They have 900 cases there among farm workers. They have a 36% positive rate. In Yakima Valley in Washington, again, these are farm workers, but also fruit and vegetable packing facilities, 600 cases. So you can see these have a tremendous impact on the food system. And not only is it that there's high rates of cases, but you know, when you have a case, that also can lead to a hospitalization and ultimately can lead to a death. And there's been numerous cases of deaths that have occurred. But the US government has mandated that these plants and these facilities stay open. And they've been talking about extending this mandate to farms as well as meatpacking facilities. So this is just an example of what's going on. So as I mentioned, I'm here in Nebraska. And as of last week, we had nearly 4,000 COVID cases among meatpacking plant workers. We had 14 deaths and 170 people who had been hospitalized because of COVID. So what are the risks for transmission? Well, we know from the CDC that the virus is spread mainly through person-to-person contact. And so that's why it's important. You've been hearing a lot of messages about social distancing and staying 6 feet apart from other people, because we know that the respiratory droplets from an infected person can be spread through coughing or sneezing or as you're even talking to somebody else. But farm workers and meatpacking plant workers, they have some other challenges. For example, the work site itself. It is very hard to social distance on a packing plant line. There's also shared worker housing, like in the examples of some of the farm worker cases. You have people who are sharing barracks together. They're sharing bunk beds in a large room, multiple bunk beds. There's also issues with shared transportation in both of these industries, people carpooling, or in the case of farm workers, sometimes there's a bus leaving from one place to take people to the farm. And so these present some really unique challenges for trying to prevent and control the spread of COVID. So here in Nebraska, we've had a team that has been conducting site visits to many of the meat processing facilities in our state. In fact, our team has done about 15 site visits. So they've actually entered the plants and they're providing technical assistance to plant leadership about the best practices for infection control. And so we have a really unique opportunity to interact with plant leadership about some of these issues. So the study that I'm going to talk to you about today is the result of a number of community engagements that we've had and the site visits that our team has conducted. And the concern that we've had that we weren't able to really get the voice of the workers. So the site visit team, they would go in, they get a nice conversation with the plant leadership and the managers, but they didn't get an opportunity to talk to the workers. And from many of the community meetings, the partners were saying, you really need to talk to the workers and try to hear what their experience is. So that's where this project is coming from. So in our survey, which was conducted in May, from May 7th to May 25th, we sought to understand how these workplaces, these meat processing facilities had responded to the COVID-19 crisis. And what were some of the information barriers, or what were some of the material barriers that workers were experiencing in the workplace and out of the workplace, and what types of preventive strategies had they engaged in. So we had over 950 records in our online survey. And once we cleaned up the database, we had 637 responses that were able to be used that were from the Midwest, consisting of Iowa, Nebraska, Kansas, and Missouri. We had the survey available in English, Spanish, and French, although we didn't get any responses in French, but we had a lot of responses in Spanish. And that may be a matter of how the survey was promoted. As you can see here, we did a lot of promotion through some of the Spanish language media outlets, the Telemundo, Mundo Latino is a newspaper and an online Facebook group, Radio Lobo, and a bilingual newspaper, El Perico. But we also did a lot of promotion through Facebook using some targeted and boosted posts, and of course with community partners who were able to share the information with the people that they normally have contact with. This study was approved through our IRB, and so that's where I'll share the information from. So here's some of the demographic characteristics of the participants in our study. You can see that about 57% of the sample was female. Most were from Mexico or from another Latin American country. Most had a high school education or less. About half were limited English proficient. And you can see here that the workers on average had been in the plants for about 7 years. We asked workers generally, how is your health? How would you rate your health? Excellent, very good, good, fair, or poor. And you can see that about 75% of the workers said that, normally my health is pretty good. We had a high rate of a high percentage of people tell us that they did have access to health insurance, which that is good, but you can see that there was a much lower percentage of people who noted that they had a regular healthcare provider. So only about 64% of people said they actually have a regular doctor that they would see. We had about more than 70% of workers who believed that they were at high risk for contracting COVID-19. I think this speaks to the importance of the issue and probably to why we had such a high number of responses to the survey. Actually, as a researcher, I was a little concerned with doing an online survey of these workers, because all of the work that we've done in the past has been face-to-face, a lot of personal connections and a lot of time spent with people. And so given the restrictions with our IRB and having we were only able to have contact with people via the phone or through internet mediums. We could not have any of that personal contact. I was worried about the responses, actually. And I was thinking to myself, if I get 200, it's going to be a good day. But we had 637, so it was a great day. We saw that only about 42% of the people who responded to our survey had been tested at the time of the survey. So they noted a number of barriers, and one of those that stuck out to me is this first bullet point. They weren't sick, so they believed they had no need to be tested. I think this speaks to the lack of information within the communities about asymptomatic transmission or pre-symptomatic transmission, which we know can both occur. There's been numerous instances, and the CDC has even noted that people who may not be showing symptoms can be shedding the virus and potentially infecting other people. We saw about a third of our participants reported that they themselves had tested positive, they had a household member who tested positive, or both they and a household member had tested positive for COVID-19. And roughly, virtually everybody knew somebody who had been affected or had tested positive for COVID-19. This is a really important slide, and this is one of the primary findings from our study, and this is about the employer responses to COVID-19. So you can see here that about 90% of our participants said at the plant where they work, they are taking temperatures for everyone entering the plant. About 83% said in their plant, everybody has to wear a mask at all times. And about 80% said that in their plant, they did have multilingual signage that had been posted about COVID, which all of these strategies are good. They're important to do. But the things that can really slow the transmission of the virus, like increasing the distance between workers on the line, slowing down the line speed, providing workers with paid time off so that they don't have to make the choice between coming to work sick and being able to put food on their table, and reducing the number of workers who are on a shift or on a rotation. Those things that can make the most difference were also the things that were the least frequently reported by the workers in our study. We also asked workers about the type of information that they had been provided with related to COVID-19 by their employer. And 70% of workers said that they had received some type of information about COVID from work, which that's good, but it still leaves 30% of workers who hadn't received anything. A lot of plants, about half of the plants you can see here, the workers reported that they were getting information about symptoms of COVID, about safety precautions, about hand washing guidelines. But workers wanted other types of information as well. For example, they wanted a lot more transparency on the number of positive cases in the plant, like what is the prevalence rate of COVID-19 in my workplace, so that they can make an informed decision on whether or not they want to come to work. They also wanted more information about contact tracing within the plant. A lot of people didn't understand, and so they felt like the employers were withholding information from them, or they weren't informing them about a potential exposure. They wanted information about what to do if a coworker or they themselves test positive, and they really wanted the employer to emphasize the importance of staying home if you're sick and have policies and procedures in place to back it up so that you can actually get paid for that time if you need to be quarantined or isolated. They wanted information about testing locations because some of the people didn't know where testing was occurring. They also wanted information about the return to work process. So if you had been positive, what do you need to do to actually re-enter the workforce? And of course, they wanted some information about financial assistance if they're unable to work, and safe carpooling and some of those other shared living types of information. The important thing to note here, though, is that health literacy level and culturally and linguistically appropriate information is really key to sharing this information. There's a lot of stuff that's been put out by the CDC, by local health departments, by lots of community organizations. Unfortunately, a lot of that information is in English, or people don't know how to find the translated versions of those. Now the CDC has lots of information that's been translated into many, many different languages, but unfortunately a lot of the workforce, these workers wouldn't know where to find that information. So we really depend on community organizations or people like social service providers who may have more contact with these workers to provide that for them. So we got a lot of stories from workers. They were more than willing to share their experiences in the plant. I had hundreds of comments in this survey. They talked about, and they really described the plants as being places that prioritize production over people. You can see some of the comments that they shared with us, that they don't trust the plants because they're only interested in production, that they don't care if their workers get sick because they only care about production, that the plant where I work isn't safe because they only care about production. They don't care about their workers, they care about money. And there was also kind of this underlying feeling of discrimination, that because they were Hispanic or they were immigrants or they were from one of these racial or ethnic minority groups, that it was okay if they get sick. And here you can see this person, they said they want us to continue to work and they don't care if we die. Somebody else mentioned, aren't we essential workers? Then they should take better care of us and respect our lives more than money. A lot of workers believe that their supervisors were only interested in getting the job done cheaply and fast. They talked about a constant pressure to make the production goals. They talked about their supervisor pressuring them to come back to work even if they were sick, or insisting that they pass through the temperature screeners to try to make it onto the line. There was even stories of some workers taking Tylenol or taking Advil to try to bring the fever down so that they can pass through the temperature screening. There was another story that somebody had shared about early on during the pandemic, when it was colder, when it was winter weather, that they would roll the windows down and put the air conditioning on so that they would feel colder when they actually got to work and be able to pass through the temperature screening. You can see that there was a lot of pressure with supervisors, so I think they're a critical link in what we're doing. Workers were really fearful, and they were pretty distressed about what was going on in the plants. They're afraid because they can't stop working. They're afraid because they needed to be able to pay the bills. They're afraid because many of them have chronic conditions or are at high risk, or have family members, household members, who may also be in some of those high risk categories. And there's even people who know people who have died, and so that has affected them and created some trauma. Workers also felt like these employers started to take action a little too late, if they had taken any action at all, and that the financial incentives that some of the plants had instated actually motivated people to continue to work even though they were sick. So they talked about how there needed to be better oversight of the working conditions, but here on the last two quotes, you can see that there was a plant where they were giving a $30 bonus for everybody who was coming to work, so a daily bonus of $30. This person said that that was pretty useful in getting sick people to come back to work, and that put everybody in more danger. Another person noted that they had what has been called a responsibility bonus. So if you show up for every shift that you're scheduled during a certain period of time, then they give you $500 or they give you $600, but that had encouraged people to continue to work even if they were symptomatic, so that they didn't lose that bonus. Workers also talked about how they can't just go and find another job, which is always one of those comments that you hear. Well, if you don't like it, you don't like the conditions, find another job. But they're structurally vulnerable. So it leaves them with little recourse to really be seen, heard, valued, and cared for by their employers. Part of that structural vulnerability is related to their immigration status. Many of the workers were undocumented. It's also related to the limited English proficiency. As I noted, about half of the people who participated in the survey were limited English proficient. So if you don't have English speaking ability, it makes it quite difficult to find a job. They also talked about not having the training, not having the formal education, not knowing the system or how to react and how to find help. And so they were really looking for the employers to take the lead in taking care of them. And I thought this was quite telling. This person said, the company logo says that we're all a family. I don't see a family now when we needed it the most. They didn't protect us. Not even the union helped. A one-time bonus doesn't help when we need compassion, not a call stating that you need to come back to work. We asked workers to give us some recommendations about what they felt might improve their work environment. And so here you can see this bullet point list is my compilation of the many comments that were in the survey and recommendations that the workers provided. They were really concerned about social distancing rules and traffic patterns. So social distancing on the line, but the traffic patterns in and out of locker rooms, hallways, cafeterias, bathrooms. They wanted to stagger breaks because they noted there were a lot of people congregating in common areas throughout the plant. They also wanted longer breaks because now you have to clean and disinfect your areas, like in the lunchroom where you may have been taking your break, and you have to have time to wash your hands and to don your personal protective equipment that may be needed now. They wanted to make sure that everybody is wearing a mask. There were workers who said, yeah, when my boss comes to tell me something, he pulls his mask down. Well, that kind of defeats the purpose of the mask. The mask is source control. It's to keep your germs to you. So if you're pulling the mask down, then you're able to share those germs, which is exactly what we don't want. They also talked about needing to have more than one mask during a shift. If you can think about meatpacking plant work, it's dirty, it's dangerous, it's demanding, there's blood, there's lots of liquids, chemicals, water, there's all kinds of dirt and dust and things that are going around too. So you can imagine that the mask gets dirty, and so they wanted to have more than one available to them so that they could change the mask at break time or at lunchtime and not necessarily have to keep the dirty one all day. They wanted more soap and hand sanitizer throughout the facilities. They talked about slowing down the line speed, particularly when you're working with with fewer workers. So there were lots of people who said, yeah, they're running the line at the same speed as they always do, except now there's 2 of us instead of 5 of us. So we're doing the work of 2 to 3 other people. And they wanted more education, more educational materials and information. So more than putting a poster on the wall, they needed somebody who they could talk to, who could explain this to them in more language that's easier to understand, who may understand some of the cultural nuances, that kind of thing. So maybe having like a community health worker or a navigator, somebody like that, a peer leader even, who could be the point of information for many of these workers. So now I'll turn to talking a little bit about the family. So we asked workers about what they're worried about. And you can see that about 93% of the workers said that they were very concerned or worried or extremely worried about bringing the virus home to their family. There were more workers who were worried about bringing the virus home to their family than those who said they were worried about getting sick themselves. You can also see that many of the workers were concerned about losing their job and having enough money to be able to feed their family and pay their bills. So in wrapping this up, we had a majority of our workers that believed that they were at high risk for contracting COVID-19, and they were really looking for their employer to take the lead and to protect them. Workers noted that there were some changes that had been made in the work environment, but as I showed you, some of the more meaningful and more relevant changes had not been made, or the guidance had not been implemented. So our team at UNMC, we've actually created a guidance document, and there's also some guidance that's available through the CDC and OSHA. So they give some minimum standards, and our meat processing playbook actually takes it a little bit further for employers. So I can give you those references and give you those links here in a minute. But workers also wanted more transparency, and they wanted to know what the plants were doing to protect them and to reduce the transmission. They also wanted to know how many people are actually positive. And what we saw is that reducing and stopping the spread of COVID-19 is not just a workplace issue, and it's not just a community issue. It's both. It's both a workplace issue and a community concern. And so we've got to have strategies that address both. So I'm gonna, this is the hierarchy of controls. For those of you who haven't seen it, these are what we would do in the occupational health and safety world is we try to focus our efforts on eliminating a hazard if at all possible. So we start at the top of the triangle. Those are gonna be the strategies that are gonna be most impactful in the workplace, right? To remove it. But in the case of a virus, you can't remove it. You can't really substitute it either, which would be our next step down. But the bottom 3 areas, the engineering controls, the administrative controls, and the practices and the personal protective equipment, are areas where we can do something about it. So engineering controls are things that we can physically do to change the workplace. Administrative controls may be policies or practices that can be implemented in the workplace. And then, of course, personal protective equipment would be a last resort. So those are used to supplement the other types of controls. So here's some of the recommended actions that we would say. In terms of engineering controls, we want to ensure appropriate social distancing strategies in the plant. That means on the line, but also in those common areas like hallways and locker rooms and cafeterias, and staggering breaks. In terms of administrative controls, we would like for plants to provide paid sick leave benefits to all of their workers. Now, many of the larger companies have said they're doing that, but unfortunately, many of the workers have said that they're not familiar with that. And so maybe it exists in the plant, in the company, but maybe that information isn't communicated all the way down to the folks on the line, which is why we recommend that we need to communicate these policy changes and these procedural changes clearly and consistency at all levels of the organization. And we need to ensure that supervisors are leading by example and holding them accountable for the health and well-being of their team instead of pressuring people to come back to work. We also need to enhance training opportunities for the workers so that they understand how to properly put on a mask and care for it, because there are some practices that are not very helpful. For example, putting your mask on and then letting it hang underneath your chin, or putting it side, when you take it off and you put it down on the table, you put the side that's near your mouth onto the table. That's not very helpful. So there's some easy training opportunities around using a mask. In terms of PPE, we recommend that all workers get a mask at the start of their shift, but then we need to make additional masks available throughout the shift. And then for education, we definitely want to provide more culturally and linguistically appropriate information for workers, particularly around this concern of asymptomatic or pre-symptomatic spread and some of the health risks that may occur with COVID, and some of the preventive strategies that are being used in the plant, so that, again, there's a level of transparency about what the plant is doing to protect the workers. We believe that workers should be informed about the contact tracing process within the plant and the number of cases that exist. We recommend partnering with local public health departments and community organizations to foster education and outreach strategies outside of the workplace, and for communities to, especially these smaller rural communities where a lot of these plants are located, is to establish a consortium of resources, community resources, that can assist workers and families if there was something to happen to their job, or if there was a plant closure, or people lost their job, or for some reason they're unable to work. We as I mentioned, we have been providing technical assistance to many of the plants in Nebraska, and you can see here in the right corner, on the right-hand corner, that there is the meat processing facility playbook, and that is the link to reach the playbook. It is on our UNMC website, so you can feel free to download that yourself. And we've also created some educational materials for workers. So it's a very simple two-sided flyer. One side talks about things that you can do at work to protect yourself. The other side talks about things that you can do outside of work to protect yourself. It's available in English, Spanish, Arabic, French, and Vietnamese. And those are also available on our website. So in terms of the study, we thank the workers who participated in the study and for sharing their perspectives about what's being done. We're hoping that this information is useful to communities as they're trying to respond and build out some strategies, and then also to improve the conditions within the meatpacking industry as a whole. There were a lot of community organizations that helped us: Heartland Worker Center, the Latino Center of the Midlands, Nebraska Appleseed, Nebraska Migrant Education Program, the Rural Community Workers Alliance in Missouri, and the Central State Center for Agricultural Safety and Health. And this is me. So I would be happy to answer any questions that you all may have. Thank you so much for your time.
Thank you for that. That was awesome. I do have a few questions that were sent to me. One was, do you think that the requirement for meat processing plants for different things of that nature to remain open is the right decision for the government to make?
That's an interesting question. I don't know if it's the right decision. What we've seen is that these plants have become epicenters. For a while, the plant in Sioux Falls, South Dakota was the epicenter of COVID-19 in the whole United States. So I think it needs to, we need to weigh the pros and the cons of each particular plant. I don't know that we can just make a sweeping decision and say all plants have to remain open. I think we need to leave that up to the local authorities based on the conditions that are happening within the plant. It does present some challenges, though, particularly when you have government and authorities who are not willing to step up and change the situation. We saw in Grand Island, Nebraska, that the mayor was calling on the governor to close the plant because of the number of cases that had occurred in that plant, but the governor did not do that. But when you do close the plant, then you have a whole series of other consequences that happen on the back end for the farmers and the producers, because they're not able to get their product process. So for example, you would hear there was a lot of concern early on about pork processing, and that many of the pork producers were going to have to euthanize the animals because they couldn't get them processed quickly enough. So that creates a real problem for the producer. So there's consequences on either side of closing or not closing. So it does put you in a pretty difficult situation.
And I had one other that was submitted to me in the chat. You mentioned how for a lot of the workers, the common thread was production over people and their experiences in the workplace. And you offered a few recommendations based on the workers that plants could enact. What has the response been from the meat processing plants in response to those recommendations? And do you think that this topic is getting the kind of traction, or traction is not even the right word, but the national attention that it deserves in light of COVID-19? Or do you think it's kind of being overshadowed, or other things are maybe more important in relation to that?
Mm-hmm. Well, I think there's definitely been a lot of media attention on the plants. I see articles almost every day in the New York Times, the Washington Post, and many other large national publications. So there is definitely people are thinking about this and trying to share the information so that there can be change. On the plant side, I have been a participant in a number of calls with our governor here in Nebraska, who was calling all the meat packing facilities to a weekly call. So he would have a weekly call with them all, and I got to join 2 or 3 of them, I don't remember, at least 2. And I did share the results of the study with the folks on that call. But there was not a great, a large response. They thought, well, yeah, it sounds about right. So I'm not sure that that they're ready to use COVID-19 as really that antagonizing moment to really change what's going on. In fact, I think what we've heard in the media already is that some companies, they had been providing sick leave to their employees, and now they're reverting back to their old attendance policies. So I think for the plants, they've seen a lot of cases, and they've seen a lot of people recover. And I think in some of the minds of some of the leadership, COVID is kind of over, and so they've moved on to the next thing, and we're going back to business as usual.
Okay, now we're going to take more questions from everyone who is here. So it looks like Linda Journey has a question. So Linda, I am going to unmute you.
Hi guys. I don't have a chat function on my side, but I wanted to know, do the closures equate to higher pricing in the marketplace?
Yeah, that's what the meat processors would tell you, is that if we close the plant, that means there's going to be less supply available, which means that there would be higher prices. I'm not sure how true all of that is, though, because there's been a number of articles, even recently, I want to say it came out today in the New York Times. They were talking about how Smithfield, which is one of the major pork producers, had been shipping lots of product, in fact, more product to China than they had in the past in April. So there was plenty of supply, apparently. It was just going elsewhere. The orders were going elsewhere. So, I'm not sure, but I do know, and from my interactions with the producers, with the farmers and the ranchers, and the industry associations, they have felt like they've got the short end of the stick. So, for example, a head of cattle was going for about $300 to a processor. The processors were on the back end. They could turn that into $1,500 or $2,000 per cow, per head of cow, for each cow. But the farmers and the ranchers were not getting any of the financial return. In fact, they were losing money on all of these deals.
Great. And next, we'll have Bill McKelvey. Bill, I'm going to unmute you now.
Thank you. Thank you, Dr. Ramos. This is very important research. I have a question about unions and worker advocacy groups. So I'm really very unfamiliar with what types of groups or what types of unions might exist, and whether or not they have an active role in kind of their response to this whole issue.
Mm-hmm. Yes, there are a number of plants that are unionized. The United Food and Commercial Workers is one of the larger meatpacking unions, or unions that represent meatpacking workers. And they are pretty active, at least here in Nebraska. They've been pretty active. And in terms of worker advocate organizations here in Nebraska, there's Nebraska Appleseed, who's been doing work with meatpacking issues for decades. And they've been consistently advocating about the poor working conditions and looking for changes that needed to be made. In Nebraska, gosh, I don't remember the year, but the state legislature actually passed a meatpacking plant worker bill of rights. And so there are a number of things that plants are supposed to be doing, like providing training. And there's supposed to be an annual report to the state legislature and to the governor about the actions related to that Bill of Rights. But what I've heard and what I've seen with a lot of the Latino community is they aren't members of the union, especially in some of the smaller rural communities. Like here in the urban area, I think in Omaha, there's more of a union presence. But definitely as you go out west, there's a feeling like the union doesn't always represent them, and that there's not a lot of benefit for the money that they pay in, or even that they may actually do more damage than do good. Those are some of the comments that I've heard from people in some of the more rural areas.
Great. Thank you.
You're welcome.
And next we'll have Dr. Brady Deaton. Brady, I'm going to unmute you. Maybe.
Oh, I'm sorry. Did you hear me already?
No, I can hear you now.
I'll start over then. Holly, thank you. Can you hear me now? Okay.
Yes.
Dr. Ramos, thank you very much for a very outstanding presentation. You know, I wanted to get your assessment. It seems to me a complex issue. Here we are facing sort of a potential second wave, and these are essential workers in our economy. And sort of where do we place the responsibility for assuring that these essential workers can fulfill their obligations, you know, to our society, and that we fulfill our obligations to them? Mm-hmm. And I really wanted to get your assessment. From hearing you talk, it sounds like there's responsibilities with the governor, the union, probably the local health service, probably government agencies. And I'm wondering, is that part of the problem, or do we have the educational forces in place to, you know, take the logical next steps here to protect them?
Yeah, that's a great question. And it is a really complex landscape to be able to protect these workers. But we need it to come from many directions, at least in my perspective. We definitely need the employers to do something. I think we need the politicians to step up and to provide, like for example, to provide funding for treatment of these workers, or of all essential workers, not just of meatpacking plant workers, but of all essential workers who may come positive with COVID. There's people are worried about the cost of treatment. Like, what happens if I get sick? I can't afford to go to the doctor. I can't afford, to what's going to happen to my family. So I think there's some opportunity on the political level to really make some change that could do some good. We've had a group on campus, an ethical consultation group that has been thinking about a lot of these issues. And they have created 3 pillars of ethical action. So what they would say is that there needs to be some on-site prevention and control in the workplace. That would be some of the playbook guidance that we've created, some of the CDC and OSHA guidance that's available. Those would be examples of things that would fall into that on-site prevention and control. But there also needs to be some off-site prevention and control. So thinking about the partnerships with the local communities, with the local public health departments. What if you set up some sort of housing facilities so that people don't necessarily need to come home to their family if they're sick, that you make these opportunities available. They're really worried about that. And one of the things that we've seen here that's been relatively successful is that the local public health department has worked with some of the hotels and our state department of health to provide housing, to provide a room in the hotel so that people can isolate and quarantine away from their families. So those are some of the strategies that people may think about in terms of that offsite prevention. And the third pillar of ethical action that our group has talked about is this treatment concern and making sure that people have access to paid sick leave. That's definitely something that could be mandated and could be a policy that is passed. We also believe that people need to have access to health care. They need to be able to have the treatment should they turn out sick. So I think it's a combination of all of those. I don't know that we can pinpoint one particular actor who's going to make it all turn good. It really needs everybody. That's why I mentioned that I really feel this is a both and opportunity to have both the workplace and the communities work together in a culture where we value transparency, where we value equity, and where we value the trust in one another, that we have our best interests in mind.
Just if I can quick follow-up, do you see the university extension being a real leader in this effort, or should be a real leader in this effort?
That's an interesting question. I haven't thought too much about that, but I think extension definitely has a role to play. I mean, a lot of the extension professionals are folks that have continuous contact with workers and their families. So definitely there could be a role for education and for providing access to resources. All the university extension folks have great access to resources and where to find information and look for information. I think that's a valuable skill that could be shared with community members.
Thank you.
You're welcome.
Does anyone else on the call have any more questions for Dr. Ramos? Cool. Okay. Well, if anyone has a question, this is now your time to speak. Lindsay, do you have a question?
I wanted to say thank you so much to Dr. Ramos. Thank you, Athena.
Yes.
Wonderful study.
Thank you. Thank you all for the opportunity. I think this is a critical point for us to be able to take some action, not just for meatpacking plant workers, but now for agricultural workers as they're moving into our region for a lot of the summer production tasks that need to happen. I think we can actually make a real big difference and get ahead of the curve on the farm worker side in our region if we use this information and to try to make a difference.
Thank you for being here with us today. I learned a lot from your conversation with us, took a lot of notes. So if anyone has any other questions or would like to get in contact with Dr. Ramos, please send us an email. We're happy to facilitate that connection for you. Again, thank you for joining us this afternoon. And as always, our video of the webinar will be on our YouTube page, probably early next week. So thank you all for joining us. Thank you, Dr. Ramos, and everyone have a great weekend.
Thank you very much, Holly and Dr. Ramos.